Uh, I'll first introduce Shomik. So Shomik is the founder and CEO of Big Fat Logic Lifestyle. Is on a mission to combat health issues, focusing on metabolic disorder like diabetes, hypertension, PCOD, and much more. So BFLL, which is operating from Kolkata, offers a unique holistic approach for combining resistance training, nutrition optimization, and lifestyle counseling, scientifically supporting a healthier lifestyle. Welcome, Shomik. So we are going to co-host our beloved Dr. Tanmoy. We we had a lot of sessions earlier also. We had private podcasts with him, and I'm so happy to have Dr. Tanmoy today. So Dr. Tanmoy Das is an MD. He's a senior consultant and head of Department of Anesthesiology, Apollo Multi-Speciality Hospitals, Kolkata, India. He's an ardent fan of low carbohydrate nutrition as well as intermittent fasting. But there are other facets also of him. So, Dr. Tanmoy, please let us know a little bit more about you.
Good evening. First of all, thank you very much, Shashi, for inviting me to speak on this historic occasion. And you and me know each other for quite some time, but I'm absolutely delighted to be here and talk about myself. I am a very mainstream doctor. I have been practicing uh, uh, acute care medicine. I'm an anesthesiologist, by the way. I spend my entire day, even now, 14, 15 hours a day in the operating room. And uh, what happened, I do have a story to tell, but I came into low-carb, at a time and in a way which I was all alone. I was struggling for knowledge. I knew that what was happening to me and to the patients around me. What I was noticing as an anesthesiologist in my operating room every day, that the number of metabolic diseases by the year, not even by the year, by the quarter of the years are going up. Like, patients coming in for knee joint replacement. Initially, we had only that as a problem, but then with passing time, each patient has more and more comorbidities. Today, every patient coming into the operating room has at least five or six. It's very sad to see. It is like a population getting absolutely decimated. But then I was getting sick. Not by even following. I didn't have a bohemian lifestyle. I was very regulated. Going by the guidelines, eat small meals throughout the day, exercise. I used to exercise. I was a member of the best gym in the city. But despite of that, despite of following whatever the medical profession offers at its best, I was putting on weight. So much so, I was, nearly about to score a century in cricket terms. But then one day while at work, I felt palpitations. I remember it was 26th of January, 2012. And so something is very wrong. So I just checked my pressure. It was sky high and didn't work that day anymore. But then I took a couple of days off, and those were the days I had to take a call. What am I going to do? Like initial checkup, pressure high, this high. I have been referred to all sort of specialists, and I knew what is going to happen in if I walk down that path. If I medicine after medicine to maintain the same parameters, just like it's just like giving paracetamol for a fever, I say. Uh, but then what is the alternative? I didn't know. And I was all alone. 2012, and well, I hit the net. Like many other people who have talked in the forum, I did find an alternative way. I found Dr. Atkins. I found Michael Eads. I found Gary Taubes. Yeah, but it was Gary Taubes, I think, extensive work which convinced me. I mean, it takes a lot to convince a mainstream doctor to change the way of treatment. And when I am involved, my life is involved, and I am putting my health at stake. But then once I was convinced, I went all the way. So And it worked. Within 6 months, I lost 25-30 kgs. From 98, I came down to 68. And the best part, the most important part was not the losing, but maintaining the weight loss. That is where I think most other forms of weight loss regimes fail. So here I was doing it was not very difficult for me to go to ketogenic, coming from a Bengali community, the part of India from where I come from. Abro was speaking before me, Dr. Abro. We are, in Bengali, this is a very interesting thing I want to say. Like rest of the world, country says veg and then non-veg. Okay. Now we in Bengal say Amish and Niramish. The default is not veg. Amish means animal and Niramish means non-animal food. So not difficult because mach, mangsho, deem, fish, meat and eggs is a part of our cuisine. And the rest of it, I omitted just like that, dropped them like a potato. And the results started within a month. And after that, after I benefited, I kept on reading, kept on accumulating, kept on convincing myself all the more. So after that, my colleagues and friends are all doctors. They're all hardcore mainstream doctors. So whenever I wanted to talk to my cardiologist who was seeing me, he was not convinced about it. And don't do all those things. Endocrinologist, no. So I had to do it all by myself. It is only now that all the proper studies are available, but that time it was not. So, Shashi, how do I share? I have a small PowerPoint to go through this. And as you had requested me, there is a very interesting theory of why people get fat. The world is still looking for an answer as to why we get fat. And there have been many theories, many strategies of dealing with it. But my topic today, the protein leverage hypothesis, is something, a kind of a different take on the cause of obesity and maybe other metabolic diseases related to it. So we'll quickly go through that presentation and then come back to discussion. And if you want to, how do I share? Should I share now?
There is a share screen in the bottom.
Right.
You have to open the PPT first. Have you opened the PPT first?
Yeah. Okay. PPT is open.
Okay. Fine. Yeah, it is coming.
Coming. Are you able to see?
Yeah. We can see.
Okay. So there you are. For the audience, I am an anesthesiologist. I work in the operating room from morning to night, even today, even of this day. I am the head of the department in Apollo Multispeciality Hospitals, Department of Anesthesia, and I've been here since 20 years now, nearly 20 years. And though I do not deal directly with patients of metabolic diseases, but I suffer the consequences, I say, of all the metabolic disease. Each patient is having a deranged metabolism, which I have to deal with, and it can be a nightmare, and they're getting sicker and sicker by the day. So while the surgeon can just operate, I have to take care of all these comorbidities in the entire perioperative period. So my job, I think, is very, very critical and stressful, no doubt. Well, here's my story. This is how I had become in 2009, nearly 90 plus kgs, and I was lacking energy. And this is after following everything medical science has to tell me. Something was not right. Something was not right. And then I told you my story, what I did. And this is how I am in my office.
Amazing. Amazing transformation.
Yeah. So not only doing it, but maintaining it, I would say. is what matters. Sustainability. I think we had a podcast on that. It is the sustainability which is important. And if I have to convince patients, if I have to convince doctors, I try my best to convince more and more doctors, because each doctor is a influencer, as Shashi says. Each doctor is a very big influencer, and that is what I have been trying to do over the years. I go after doctors, and you'll be happy to know that at the moment more than 24 doctors, they follow me in the hospital. They have done it to themselves. Some of them are closeted, they won't admit it, but they do it, and each of them have got health benefits, and so it has started a trend. I have no conflict of interest to declare other than my YouTube channel, which is known as the Healthy Drive. And if you are interested, you can subscribe and go through it. I've been a bit irregular recently, but yeah, I hope to pick up. And I think this conference has inspired me, and a lot. So maybe I'll do that. Okay, so coming to this a little bit a topic, a little bit of deviation. I will discuss protein leverage hypothesis for the next few minutes, couple of minutes. So I'll start with the macronutrients that we eat. Fat, protein, carbohydrates, these are the macros, and there are micros. But I will focus only on the macros, because I believe that if you take care of your macros well, the micros will take care of themselves. So basically, protein is the most important macronutrient that we eat. We must have all realized this by now. And if you do not get enough protein, then it is possible that you might be driven to overeat an excess amount of carbs and fat. So I'm going to tell you how and why. This is the proposition that if you do not get enough protein in your diet, you might be driven to eat more of carbs and fats. So I have borrowed slides liberally from the low-carb world. Many of you will recognize them, but keep listening. Proteins are the building blocks of the body, whereas carbohydrate and fat, they are the fuel. Your body runs on two fuels. This is what most doctors still don't realize and don't tell patients, that body not only runs on carbohydrates, but it has a equally or even better fuel, which are the fats. So proteins are the building blocks. So what does it mean? It means that not only proteins need to build our muscles, but all the cells in the body need proteins for its structure and function. All our enzymes and hormones are made of proteins. But unlike the other two, proteins cannot be stored. And nature and our evolution has understood this, and understood this crucial role of protein, and have taken measures to make sure that we get an adequate amount of protein that our body needs. So this is the theory or the hypothesis. A lot of research which the scientists have done, I'll tell you about them, have shown that all of us, whether it is an insect or a primate or any animal or human beings, we have a universal craving for protein that helps the animal to reach the target protein when we eat. And a very small change in the protein, that if it gets diluted, it may result in a very big change in the excess amount of carbohydrates and fat being taken in as a compensation. So this evolutionarily built-in appetite can leverage excess of carbohydrates and fats, as I told you. So this dilution of dietary protein, which has occurred over the ages, has is what is causing the problem. So this is the hypothesis, that there is inadequate dietary protein in the food that surrounds us today, which leads to a craving for the protein, and there is a tendency to consume non-protein energy, that is energy which is not from protein, and this leads to overeating and obesity, type 2 diabetes, and other diseases. So if you see the diagram on the right, it says that if your protein is less, your carbohydrates and fats tends to go up. So if you want to use the liver, you can just push up the protein or just dial down the carbohydrates and fat a little bit so that a protein percentage goes up. So this has been developed by David Robbenheimer and Stephen Simpson. These are Australian scientists, and I will tell you a little more about them later. But then, what they have said, according to them, that this does not mean that you can go on eating protein, or that more the protein, the better it is. Protein is actually the most satiating of all foods. And there is a built-in evolutionary mechanism just to take in the right amount of protein if you listen to your body. So once the protein needs are satisfied, that appetite disappears. So it gets regulated. So we must look to evolution for an answer always. So I always say that nothing in biology makes sense except in the light of evolution. This was an Ukrainian geneticist. And so what has happened during our evolution is, during the time in the era prior to agriculture, that is in the Paleolithic time, we used to eat a lot of protein in our diet when we were hunter-gatherers. Nearly 50% of our energy would come from proteins. But then came the agricultural revolution. Then protein got diluted a little bit because we invented wheat, and then later on rice came along, and the starch along with that. And then our proteins, we had to take in more amount of energy to get that amount of protein. Now, if we fast forward to the industrial revolution, and now today in the era of ultra processed food, our protein around us availability has got diluted like anything, and that is why we need by the time we satisfy get satisfaction from our food, we have taken in at the cost of a lot of sugar and flour and seed oil. So that is what is creating the obesity. You can see the body shape, how it has changed. So what is happening over here is obesity is something which is simultaneously pushed forward by the dilution of protein and minerals and pulled forward by the frequent co-ingestion of carbohydrate and fat. So this is what is happening today, and that it partly explains the obesity. So according to the doctors Robbenheimer and Simpson, it does not advocate any particular type of diet. They do not. It only attempts to throw light on the root causes of obesity and other metabolic diseases. So what I want to, this is the protein leverage hypothesis. And how is this relevant to us today? Us, I specifically mean our country and other countries like us. So this is the typical Indian thali. We have been discussing it throughout the conference. And this has been found to be, very high in carbohydrates, very high in cereals, and very low in protein. Well, this is not, and anyone can make that out. But if you look at the this British Journal of Nutrition publication, which was as back as 2012, they said that Indian diets derived almost 60% of their proteins from cereals. But although the disadvantaged population get around 1 gram per kg per day as a calculation, but actually it is not bioavailable. Something known as PDCAS, which means protein digestibility corrected amino acid. In simple words, the bioavailability is less. So even with this 1 gram per kg calculation, there is a real scare that they are not getting enough protein in the diet. And if you forward it to 2020, the news is not good, because they have even reduced the dietary recommendation from 0.1 to 0.8 per kg per day. So what we have to remember, that this is bare minimum to keep your biological functions going, and 0.8 per kg per day is certainly not adequate. But the tragedy in our country is we get even less than that, I'll tell you. And this was a study which compares with Eat Lancet reference diet. Mind you, Eat Lancet guidelines are also not adequate protein. They also recommend 0.8. But even compared to the Eat Lancet, they found and recommended to the government, best part was they could recommend that Indian diets across all states, across all income groups are unhealthy. Why? Because they consume a lot, very less protein. They consume excess amount of cereals and not enough proteins, fruits and vegetables. Whether you are a vegetarian or a non-vegetarian in your country, we do not consume enough vegetables. So Indian policymakers need to look into this. That's what. That's the only thing was they could recommend. That's all. There was a survey called the Prodigy Survey. This Prodigy Survey showed that a whopping 85% of the Indians are protein deficient. Whether you are a vegetarian or a non-vegetarian, it doesn't matter. They are all protein deficient. As we were discussing today in another session, that it's a very dicey, it's a very dubious, not dubious, very nebulous concept, this vegetarianism and non-vegetarian. Somebody eating one piece of small chicken in a big plate of biryani, I mean, you hardly get the protein that you need. So we are not only a protein deficient nation, according to the Prodigy Survey, we are also a protein unaware nation. There was a very interesting study done by a group which is known as the protein paradox study. I will not go into the details, just that there was a group called Right to Protein who surveyed 2000 mothers according to the perception of protein, and 95 they found that 95% of the mothers, they knew about protein, but they did not they knew that protein was important, but they could not identify the proper protein foods. So only 3% could understand the prominent functions of protein. So that is why this they call that protein paucity, then protein psych. So because they had a lot of wrong, Indian mothers have a wrong conception about protein. They think that protein leads to weight gain, and also that they would prioritize the consumption of vitamins and carbohydrates rather than protein. So this kind of misconception exists. And there is something known as protein pinch. And they actually could not identify the correct amount of protein. They thought that incorrectly perceived to have a high protein content means fruits, rice, green leafy vegetables were thought to have high protein. Very few items were identified correctly, you can see over here. So you can all go through this protein pause paradox study and the Prodigy Survey. So as I said, across the population, protein deficient is an epidemic. Like, so if you want some data, these are the city-wise data which the survey found. Even the urban rich, it's not the money which matters, it's not the affordability. Even if you have the we say that protein is expensive. Yes, protein is expensive, but even if you have, you can afford, if you don't have the knowledge, the awareness, which food can give you high protein, you're going to be protein deficient, and that is what has happened. So this is a grim picture of our country. And if you look at protein consumption around the globe, India is perhaps one of the lowest protein eating countries in the whole world. So that is one problem, protein deficiency. Now there is another problem in our country which is known as obesity. Obesity has become an epidemic. I don't have to submit slides and papers. You just look around you in any shopping mall, any airport, any gathering. You see the more than half the people have either visibly obese or have thin obese people, as I'm going to tell you about that. So percentage of overweight Indians have been going up. Now, the saddest thing, as we have already talked, is the childhood obesity. Why are Indian children getting fatter? And imagine somebody having to go a bariatric surgery at the age of 14 years old. And this is something very, very drastic and totally unnecessary. So data from Science and Environment India shows that obesity costs India 2.8 crores in expenses. So not only it costs the country, I think I shared this with you, Shashi, some time back. it also affects the individual. Imagine a whole generation growing up fat and unfit to do the things in life which they want to do. So yes, and if you look at the data of 2023, the greatest impacting population is I think the children, and they are the ones who are going to, the next generation is going to be very, very obese. And not only that, the obesity, this type in India, there is something known as over fat, means the degree of harmful fat in the body is much more. Obesity in our country is not visible. It is kind of very common thing you will see. We have discussed this just quickly. This is known as the TOFI. This is TOFI can be measured very simply by the waist height ratio. Waist in inches by height in inches, it should be less than 0.5. If it is anything more than 0.5, you have belly fat. So this is a quick clinical way of doing it, and it's known as a poor man's DEXA scan. The example given is mine. So 0.48, how it should be. And studies have shown that if your waist to height ratio is less than 0.5, then you have better life quality of life, health quality of life. So contributing to this obesity is our over dependency on rice and wheat and our lifestyle changes. Another very alarming statistic is that already 70% of the population rely on ready to eat and ready to cook foods, and so we are not cooking enough. We all think that we have healthy food, but we are not actually having food which is healthy. Plus the rice is no longer the rice we have, the wheat is no longer the wheat which was there. So what we eat today, most of them are what you known as obesogenic. So as I was telling you, we are still looking for an answer as to why we get fat. The most common, even the WHO tells that because we get fat because we eat more and we exercise less. So the advice is given that you eat less and exercise more, and we all know it doesn't work. So there is fundamental disagreement. So that is why there is a desperate need to a proper answer to that question, and this is where the scientists gave a theory. Dr. Simpson and Dr. Robenheimer. Actually, they have been working on it long since the 80s and 90s. But do you know who stopped them? It is the mainstream researchers of human researchers. These scientists are entomologists, and the reason they gave was that we could not accept the fact that entomologists can come up with a theory which we haven't come up with. So it was amazing how this, and 10 years later, they have given an update. You can go through that. Why this protein leverage theory hypothesis is, they have done randomized trials and it works all the time, explains. And yes, these are some of their papers. So basically, we all live in a low protein environment. So if you start eating unbalanced diet, which is a low balanced diet, and your innate, if you listen to your innate appetite, it can direct you to get a balanced diet. But if you do not, then you may land up in eating excess of food. So this is the leverage which I was talking about. So basically, there are two major issues in our country. One is protein deficiency and one is obesity. The question which I want to ask is, are they linked? Could the protein deficiency be driving the obesity epidemic? And can we use the protein leverage to dial down this excess energy consumption? So that is what, actually, if you look at it that way, our ancestors possess the ability to know intuitively how much to eat and when to stop eating. And this has been demonstrated in all kinds of species. They still have it. You look at your pet dog, he will stop eating when he is slightly sick. First thing he will do is stop eating. But when we become sick, we start eating all the more. So when did we lose this ability is the thing. Oh, this is the book which they have written. I have no conflicts of interest with them, but it's a gripping story of how protein leverage works and how we should learn from the age of healthy eating. I have a copy with me here. And so how do we implement the protein leverage diet? So there is no diet as such, but how do you implement it? you can apply the principles. Just keep this figure in mind and you track your food intake for a week. From there, you can kind of just dial down. You don't have to start eating a lot of protein all of a sudden. You can just keep in mind what are the excess of carbs and other fats, means unhealthy fats which you are eating, and dial them down so your protein percentage goes up. That itself will give you more satiety, and that itself can lead you to eat less. So, because food quality determines food quantity. If you are eating nutrient dense foods, you will automatically kind of land up eating less, and as a result, not suffer from obesity. Well, that's it. I wanted to tell about.
I have a question. Can I ask Mr. Anga? Okay. Yeah, so I'm going ahead with the question. So basically, Dr. Dash, as you said, this bioavailability of the protein, that actually matters. So whenever we try to tell the people or like the clients, like regarding the protein intake, they always get this question in their mind that we are eating dal or we are eating this vegetable or something like that. Okay, and they try to explain that we are eating the protein. Okay, now the fact comes of the bioavailability. As you said, like, would you please explain this matter of bioavailability? Like, all proteins are not the same. Like, all the proteins, like if I compare the proteins of pulses or lentils and the eggs, both of these two things are not same. So can you just please explain a little bit, elaborate about this fact?
Preliminary knowledge of proteins, there are first class proteins and then there are second class proteins. So proteins have to be bioavailable, have to be absorbed by the body and then do the function which it is needed to do. But the problem with dals and lentils are they come along with a lot of carbohydrates along with them. Carbohydrates are even the starchy or the ones which comes in grains. They are dense, but they are like sugar molecules joining hands. So once the dal is boiled, so it becomes simple sugar along with the protein. So you get the protein, but at what cost? As a nutrient dense food like egg, I use eggs as coins to explain. Eggs will give you 6 solid grams of protein. So then I tell, if you want to get the same amount of protein in dal, you have to eat a big bowl of dal. So by the time you consume the dal, your tummy will be full and yet you will not get the protein. So that's what is happening. And you consume a lot of carbohydrate in the thali, which makes you physically full, but you still don't get the protein and the hunger remains.
So Raj, what we will do is, Shomik, we will ask all those questions which are myths actually, and there's a right opportunity because doctor has explained the protein leverage hypothesis very nicely. So what I want is we will ask all those myths to doctor. Starting, I want to ask the one question that protein loads the kidney. This is the common myth. Can you please elaborate on this? Raj, meanwhile, check your mobile.
Actually, this is a myth. This has come from some animal experiments done very long back where rats were tested and with some amino acids. But studies and guidelines also do not support this. Let us make it into two parts. As long as your kidneys are healthy, protein is not an issue. You can eat any amount of protein, up to 3.2 grams per kg per day. The athlete group, the bodybuilders group, where protein is given to build bodies along with resistance training, it is not an issue. Now the misconception is where you suspect that there is already having kidney disease. So once again, let me make it very clear. If you have normal healthy kidneys, protein does not damage the kidneys. No amount of protein damages it. You cannot store in the protein. The healthy protein will take away the amino acid, it will metabolize into purines and it will be washed away. Now, our concern, our fear is the myth going around that If in a damaged kidney, what will happen if I load that kidney with protein? So the evidence and the guidelines have also been conflicted. The famous, I think Dr. Jason Fung also quoted a study which was done in 1994, which was known as the DMRD study, MDRD study. So that also showed that if you make a very low protein diet, it does not prevent the deterioration of the kidney function on a low protein diet. And today, fast forward to 2020, if you look at the guidelines, that also does not prove. And in fact, just in the pre-dialysis stage, that could be the problem. But once you go on dialysis, once again, the protein requirements become very high because you have to compensate for the protein loss which occurs. So it is not true that protein, first of all, protein causes harm to the kidney. It is not true that a low protein diet will necessarily halt the progression of chronic kidney disease. Very important to remember that kidney disease is not caused by protein. Kidney disease, the most common one, that is diabetic kidney, because diabetes is the #1 problem for kidney disease, is caused by hyperinsulinemia. It is caused where the kidney is already damaged by some other process. We tend to look at only that part where it is already there. So that is the issue. So we are blaming the wrong culprit once again. Kidney doesn't. One should try to correct that hyperinsulinemia. One should aim to correct that, the root cause of the disease, instead of blaming the protein. So, and once again, in a chronic kidney disease state, you need the protein, because as we are realizing more and more, muscle health is the most important part of health now. So unless and these people, they lose muscles very fast. They lose so you need protein. In fact, there's a very interesting thing which a perspective from American Society of Nephrology. It says all a low protein diet does is to shrink the patient down to the size of his kidneys. Even they are admitting it. So
what is the recommendation of proteins in CKD as per the Kidney Association?
Well, they have divided into 2 LPD and very low LPD diets, and 0.2 to 0.4. It has been conflicting. I had one more slide. If you want, I can share that. Different people have given different.
I think we can just share on a broader
one slide. Just one slide I can share. Different people have given different recommendation about protein. So can you see this slide?
Yeah.
So if you go by year wise, 2000, 0.6 to 0.8, 0.3 to 0.5 low protein diet, and then the other guidelines, if more nearer to us, 0.8. See, these are not very different from the usual recommendations of RDA, 0.8. And what I would like to add is, this is KDOQI, Kidney Disease Outcome Quality Index guidelines, 0.5 to 0.6. See, in our country especially, where we already have such a pathetic protein intake, these guidelines do not apply.
Dr. Tanmoy, I want to make a point here that our average population intake of protein does not even match what they are giving for acute patients.
Absolutely. Right. So how do these guidelines match? And the problem is, our mainstream doctors, we think the Western guidelines as, and we follow them blindly. But we need to tailor them, apply them here. See, there where already the population is having more than 1.2 to 1.6 grams per kg, then maybe you can think of this. But here, where the population is having 0.3, 0.4, we are already on a low protein. I think we should give them more protein rather than think of,
Yeah.
So from this,
Raj,
can
you
we
take up one more myth?
Yeah, sure. That is what I was about to do. So basically, Dr. Dash, can you just explain that how much protein intake should be for a normal person? Like, because as you said, like 0.3 gram, 0.4 gram per kg of body weight people are
Yes,
having. So what
very
should be the ideal protein intake per day?
for a normal person, you mentioned that. Yeah,
For a normal
Yeah,
sedentary person, what should be the
exactly.
protein intake?
Exactly.
for a normal sedentary person, I think it should be minimum 1 gram per kg per day, not 0.8.
So
0.8
this 1 gram is of what protein?
Right.
first class protein. First
That's the
class.
point, because like people
Uh,
think, like as I said, like I am having dal, lentils, all these things.
mhm,
So even
mhm.
sattu or something like that. So I'm getting enough amount of protein from that. So that is where the confusion and the misconception comes in forward.
I use eggs as coins. I said, okay, you weigh 70 kgs, so you need 1 grams of 70 grams of protein per day minimum.
Right.
So 7 eggs, the small medium size eggs,
Hmm.
6 7 eggs minimum you can take. But
Hmm.
the problem is no one takes 7 eggs or 10 eggs per day. So
Right.
that is a unit of calculation, and any other first class protein like fish and meat,
Hmm. Hmm.
you can have like pack of card size will give you,
Hmm.
that is 100 grams, that will give you 20 grams of protein.
Right.
So I do share protein charts,
Hmm.
and that is
Hmm.
how I convince my patients to take
Right.
more
Right.
protein, calculation. Teach them how to calculate. But answering a question, Sashi, minimum 1 gram,
1 gram.
I would say, and if you are a little active, 1.2 grams.
Hmm.
And as you grow older, your protein needs go higher,
Right.
much
Right.
higher. We lose protein very fast once you
Right.
cross.
So, Doc, we have just 18 minutes. I want to ask you as much myths as possible, and I want razor sharp
Hmm.
answers so that we
Hmm.
incorporate a lot of myths. Now, the
Okay.
next one is protein causes hyperuricemia and gout.
No. Your body already makes purines by degradation of proteins, and that is what goes out of the body.
Hmm.
Protein does not add to that. Protein just adds to the building of your hormones, your enzymes, your muscles. The normal breakdown is always there. No, that is another myth.
Hmm.
Fine. There's one more question coming in from the audience. Can you address the fact that body needs to be alkaline for health? Eating a lot of meat and protein makes body acidic. How to deal with it?
Yes, alkalinity is something which has not been studied as hardcore science. We do know about it, alkalinity, but no, I have not noticed that in my practice. I do have a small practice of low carb patients. I have not noticed that. I do not specially make my patient alkaline. So, and I don't think by eating a lot of protein, body becomes acidic.
I think there's a confusion on this that
No,
human stomach is acidic to digest protein, and
very
and
much.
the pH
Do you know
of
the
different parts of
Hmm.
body are
Hmm.
different.
do you
The,
know
the,
the
the blood
pH of
pH is
stomach?
different. The
Do you know
stomach
the
pH is
pH?
different.
Do you know the stomach pH? Well, blood pH is 7.2, but our stomach pH is 1.2, which is as most acidic, like a carnivore animal. That is what we have evolved with, that so that we could digest and proteins and keep the germs out.
Hmm.
So yes,
Yeah.
next.
So the next question comes is whey proteins, are they bad or good?
That's
Well,
a commonly asked
I
question.
would
Yeah.
use them. Good question. Yeah, everyone is asking that question. First of all, whey protein is a animal protein. It comes from freeze drying of the whey, and it is used as a supplement. We should never forget that. It should never be a substitute, but it is a supplement. I use whey protein in my practice only when I find that person is not taking first class proteins, and at the end of the day, he's still protein deficient. While it is good, there are no long term studies as to the effect of whey proteins. And the last point I want to make is that because it is pre digested, the satiety is far less when you eat real protein. The satiety which comes from eating 3 eggs or 4 eggs fried in butter will not come from 2 scoops of whey powder.
Thank you. Thank you.
I think because of the low fat content, is it right? Because the isolate whey out of whey protein that works only
There's
with the
no
protein
fat.
part.
There's no fat, but amino acids, proteins themselves are very satiating.
Mhm.
But it doesn't come from I have not seen, it doesn't come from a whey protein powder. If you are very conscious, if you are doing training, you can have the extra amount, but that has to be kept in mind. And I'm still waiting for very long-term studies on see, I always look to evolution for an answer. For millions of years, we didn't have whey protein. But we still had six-pack bodies before the agricultural revolution. And we do so, and there are plenty of people who do not take whey protein and still have excellent muscles. How do they do that?
So maybe Shomik, you can give a short perspective of whey protein from your bodybuilding point of view. Very sharp.
See, only from the bodybuilding point of view, as a Dr. Tanmoy said, like, it's required only if your protein intake is not getting fulfilled, or like you are not eating sufficiently the whole foods. So all the time that we recommend to our clients that have protein shake, have whey protein. If you are not getting enough time like to cook food or like carrying food, then you can just carry it because it's a supplement, right? Just it will fulfill the requirement of your overall protein intake. And if you're an athlete, or like if you are working out hardly, then you must take whey protein, because that would help you to increase your overall protein intake, because that time it goes up to like 1.5 to 2 gram per kg of body weight. For me, like sometimes I take, sometimes I not. When I feel, I just take, otherwise not, because I believe more on like more into whole foods. Like I eat 15 eggs a day. So for me, it's like whey protein is not required but for the people, like I cannot just recommend that, because people don't eat like that way, right? So that time it's actually beneficial, but it's completely relative. It depends on person to person. That's my point of view.
Fine. There are 2 more questions in chat.
Yes.
Very interesting question. I'll take the first shorter one. Is it true that people with hypertension should not be given high protein diet?
No. Hypertension has nothing to do with protein. Hypertension is pure hyperinsulinemia. See, for a very long time, we didn't understand the cause of high blood pressure. So we called it essential hypertension. When the cause was found, maybe renal artery stenosis for some patients, we used to call it renovascular. But other than that, the entire medical mainstream science and literature and our textbooks have said, what is hypertension? Essential hypertension. But recently, studies are showing that hypertension is nothing but hyperinsulinemia. And one of the first things which happens when you go on a low-carb diet is that your blood pressure comes down. In fact, patients have to be handheld because they might have side effects of hypotension if they don't realize what is going on. As the insulin level drops, so does the blood pressure. So,
that means, Dr. Tanmoy, you want to say that actually if a person goes on high protein diet, his blood pressure drops?
Yes, high protein diet and low carb.
So it is the reverse of what the person is asking. Actually,
Absolutely.
if they go on a higher protein diet, reduce the carbohydrate, their blood pressure will normalize, facilitating the lowering of medication.
Most people who go on a properly formulated ketogenic diet come off antihypertensive medications.
Right. There's a very interesting question. Does having low carb, high protein food, especially meat diet, result in higher sexual energy? Is it a trend across or individualistic? So what is your answer to this?
My answer is it results in normal sexual energy. Everything else was below normal. You are supposed to be active throughout your life. Our human bodies, they're fantastic machines. We all have a lifespan. We also have a health span, including sexual health span. And that all these 3 graphs should be equal throughout your life. Till the day you are alive, you should be,
Very good. So does protein cause heat? Too much protein or normal protein cause heat?
What exactly is meant by that heat?
That is a common thing in India. Heat ho jata hai. We cannot take eggs in summer because heat hota hai.
That
Right.
heat is something, it is a perception, and maybe it means acidity in some people, or maybe it means you feel more energetic. Unlike rice, dal, a lot of carbohydrate meal, you feel everyone feels sloggy, drowsy after that, because a lot of energy is going into digestion. But if you eat a high protein meal, I have seen that you feel more energetic and you feel less. So that, I don't know, we call that heat.
I have something to add to
Yeah.
this fact. So basically, like we have discussed this before, when somebody is eating eggs along with rice or high carbohydrate, those things at the time of digestion, it creates some bloating sensation. Okay, so that time, that sensation, people may call that heat or like that burning sensation inside of the stomach. I think that.
Maybe.
And,
Any
and
other question?
personally, my experience also goes that I take 6 eggs in a standing, maybe 6 to 12 in a day. There is no heat and all. So it is probably something else. And whether it is summer, rain, or winter, I take. Now, Doc, there's a very interesting question which has come in the chat. Shomik, you can also check in the chat of your Zoom. There's a question from Rajasthan. How are kushti or wrestling Pahalwan? They use simple veg food supplemented with badam, ragda for protein. Even without meat paneer, they're able to have great strength and endurance. How?
Yes.
Should I answer or like Dr. Dash?
Anyone can answer. Shomik, you can also answer because you're involved in this.
I'll just lead him on so that he can answer.
Okay. So it's a very interesting question. So let me answer it.
So
first
it
of
is
all,
not only the protein quality, but it is also the resistance training, which is another amazing thing. I think Shomik is an expert.
So basically what happens whenever we talk about wrestlers or like pahalwans, that time they are not just focusing on the overall metabolic health or like overall well-being. They are focusing on the high energy outburst. Okay, so that time the carbohydrates or any other sources that actually help. I agree, but the matter comes the normal people. We are not wrestlers, we are not pahalwans. Okay, so we don't need that much amount of carbohydrates or any other sources that we will be utilizing, right? So that is where the difference comes up. So the pahalwans wrestlers, they eat that kind of food, that huge amount of carbohydrates. So if you get to see, the amount of lean muscle mass is very very like moderate, but the amount of fat mass that they are carrying over the layer, that's huge, and that makes them huge, that makes them big, and that's why they are pahalwans. Okay, so for the normal people where there are no such activity, there is no point of having that much of carbohydrates or like that much amount of food, overall calorie intake a day, and because there will be no utilization because we are sitting and we are not working that much. So that same thing goes with any like powerlifting athlete or any weightlifting athlete. We get to see a lot of weightlifters eat a lot of rice, but they are carrying too much of fat. That's the point.
Our pahalwans not only have a lot of muscle, they also have a lot of abdominal fat, which is not.
Yeah, that's the point.
There is a question here: is plant protein powder superior or whey protein?
Spiked with amino acids, all the plant protein powders. If you get to see the lab test, because I know a person, actually the person who directly supplies the flavors to the whey protein manufacturing companies. So the fact is, if you just get to see, then the overall content of the protein is getting spiked by the amino acids. Okay, so the overall quality of the protein which is coming from the plant base, that's not at all bioavailable.
Fine, thanks. So there is a comment here. Someone has made a comment that vegetarians usually cancel meat after saying that you have become violent. Does meat eating become violent?
I don't think so. I'm not a violent person. I don't think there's no evidence that a kind of food can affect your attitude towards others. No, that is entirely a mental conditioning. I don't think you need nutritious food. Let us talk science here. We need nutrition, and we need densely nutrition food. The food around us is not densely nutrition by any standards. So we need to be aware. We need to have the knowledge to identify this food is nutritionally dense for me and will nourish me. And that is what is important, and that is what we are trying to make everyone aware.
The next question comes is protein causes constipation.
Yes, that is a question I face in quite a few of my patients. Um, Let me tell you one interesting thing. You know what happens is when we eat, especially when we eat first class proteins like fish, meat, and eggs, it is 99% absorbed. Now there is no residue. The residue is only with the rice and the vegetables that we eat. So that is why, first of all, one has to give up the conditioning that when the bowels have to move every day or twice a day. That conditioning has to go. We have evolved for a lot of, once again, evolution. We did not have to get up 6 o'clock in the morning and every day go for, emptying the bowels. That is the conditioning. So once you get rid of that and just wait, initially it happens all the more. And some people whom I put on a very high protein diet, ketogenic diet, they do complain, but it usually settles down in more than 90% of the patients. And for some people, you can add a little bit of green leafy vegetables or sometimes a supplement like Softovac, but very rarely.
Fine.
It is a temporary thing, goes away with time, and one need not worry about it.
And thanks. We have around 3 minutes. Shomik, do you have any another myth busting question?
Not right now, because like all of these like questions Dr. Dash has already covered.
And I'm coming with one
Okay.
more question. People say that eating eggs will raise estrogen and high cholesterol.
No way. Don't worry about cholesterol. The entire audience.
Yeah, what about estrogen? Because people say that it is pumped with steroids.
No, it doesn't go
Yeah,
in.
yeah. If they are eating, normal, available, low quality eggs, we are not sure about the eggs they are eating. So that time, I'm not sure about the estrogen fact. But yes, the overall farming process, yeah, that's bad. That's bad.
Fine. Is high protein safe in IBS situation? Irritable bowel syndrome.
Yeah. Yes, because protein is not inflammatory at all. So IBS is an autoimmune condition. And in all autoimmune condition that we have seen, get rid of the confounding factors first. Just stop eating anything coming out of a packet. That will settle the issue. And then proteins will heal. Bone broth heals like anything I have seen in IBS. I have used it in my patients. After that, proteins, whatever proteins you can eat.
Fine. So we have around 1.5 minutes. What is the good protein source for vegetarians? Very, very common question.
Sashi.
The people are asking it.
Okay. For vegetarians, I think our vegetarians in our country, we are lucky. We eat dairy products. So paneer, cottage cheese, paneer, and can be a source. And legumes and grain can also be a source, provided they are taken in the way traditionally, like soybean. Soybeans has all the essential amino acids, but not the soya chunks which are available in the market. If you want to have soybeans, soak them overnight, and then then maybe cook them, and that is how you should have the.
And I think that's how in the Orient they have it as fermented on miso, natto.
Ferment them, ferment your food. And
So I think, Doc, the time is up, and Dr. Sunil Menon is now waiting to enter into the arena with Mr. Venkatesh. So Dr. Tanmoy, thank you very much, so that we can burst a lot of myth, and especially your PPT on presentation on protein leverage hypothesis, plus the additional features which you have shown is really good. And I think this particular session, once we release it, it's going to become a very good reference point. And Shomik, thank you very much.
Thank you so much for inviting me.
Your own perspective, because you're running a gym, and on how that...
not gym. It's a wellness studio. Very soon it will be
okay, it's a wellness studio. Fine. So thank you. And thank you, both of you, for coming for this historic event. And
let this be the beginning, not the ending.
Right.
We will have more sessions, Doctor, with you and Tanmoy. Dr. Tanmoy and Shomik, we will have more sessions. So thank you very much.